Cirrus Medical Network, your doctor online. Hypertension, part of the Telemedicine Primary Care Series. What is blood pressure? Typically, blood pressure is defined as systolic pressure over diastolic pressure, where systolic blood pressure is the pressure in the arteries at the time of the heartbeat or contraction, and diastolic blood pressure is the pressure in the arteries at the time that the heart relaxes. Normal range for blood pressure is anywhere from a systolic of 95 to 140 over a diastolic of 60 to 90. So how should you measure blood pressure? Well, first of all, you should be relaxed. Should avoid caffeine or tobacco products for about 30 minutes prior to checking. Make sure your machine is calibrated if you are using a home blood pressure cuff. The width of the cuff should be the appropriate size, typically around 80% of the arm circumference and covering 2/3 of the arm length. You should get two readings about 5 minutes apart. What is high blood pressure then? Well, blood pressure over 140 over 90 in a person under the age of 60 years old, unless they're diabetic, then it doesn't matter what their age is considered high blood pressure or hypertension. According to the latest guidelines, the JNC8, a blood pressure over 150 over 90 in a patient over the age of 60 years old is considered hypertension. So, why does this matter? Why do we care? Well, there are several reasons why we care about uncontrolled, persistent, elevated blood pressures. First of all, stroke and heart attack, the most common conditions that one thinks of that are associated with blood pressure, but really there are all kinds of systems that are affected by uncontrolled blood pressure, including the vascular system, where you can get hardening of the arteries or atherosclerosis, peripheral artery disease. You can get kidney disease because of uncontrolled blood pressure, eye and retinal disease, and certainly heart failure. If you consider the heart essentially a muscle that is beating against a pressure over and over and over, at some point there's going to be muscle failure or fatigue. It's not too unlike lifting weights or exercising when one hits the point of muscle failure. So what affects the blood pressure? Well, again, it's a muscular pump. It responds to signals, electrical and or chemical, from a variety of organs, including the brain. Stress and stroke can affect blood pressure. The kidneys, which are essentially the body's thermostat and monitor the amount of fluid or hydration status in the body, can affect blood pressure and send signals to the heart to raise or lower blood pressure, and as well as to your blood vessels to lower resistance or increase resistance. Your adrenal glands secrete hormones and chemical signals as well. Thyroid can sometimes affect this, as it is very involved in metabolism. And as I mentioned before, atherosclerosis, or hardening of the arteries, essentially narrows those blood vessels, kind of like clogged pipes, and the pressure to push the blood through needs to increase. And of course, your natural pacemaker, which creates the rate or the pulse, can increase and essentially result in elevated blood pressure. So tachycardia or fast heart rate can lead to elevated blood pressure. What affects the blood pressure? Well, there are several influences of blood pressure. Tobacco and alcohol are number one in the lifestyle, as well as weight, of course. And along with weight, some people get sleep apnea, and this results in elevated blood pressures. Some other lifestyle choices and or medicines that folks are on can lead to elevated blood pressure. Specifically, the common things that I see in the office are benzodiazepine use, like Xanax or Ativan, Valium, common relaxer medicines, as well as pain medicines like Vicodin or Percocet, oxycodone, hydrocodone, and other narcotics. Withdrawal from these, especially if you've been on them for a while, can lead to elevated blood pressure transiently. most of the time, but sometimes over a longer period of time as well. As mentioned previously, stress can cause elevated blood pressure. And anxiety, it's that adrenaline response that creates the changes that we see in the body that create elevated blood pressure. When you look at the body like a tank of water, essentially, or like an inner tube, when you fill it with air, or in this case water, and where salt goes, water goes, then the pressure goes up. You let out the air in a tire, just like you sometimes use diuretics to lower blood pressure. You let out the water, diurese it, then your blood pressure goes down. Certain medications can affect blood pressure, like stimulant medicines. Some of these stimulants are even in simple over-the-counter decongestant medicines like pseudoephedrine or phenylephrine. Over time, blood pressure does go up with age. Usually this is from stiffer arteries. They're less compliant, they're less forgiving, and so there's a natural progression for one's blood pressure to rise with age. But this can be usually staved off with regular aerobic exercise and maintaining a healthy weight. Family history does play a role in blood pressure, and certainly it's important to tell your physician if you have a family history of hypertension. Certain kidney issues or diseases can contribute to blood pressure as well, and as I mentioned, obesity and sleep apnea. Less common causes for elevated blood pressure include heart valve disorders and heart valve problems, and brain disorders such as stroke and or tumors. So when do I need to worry? Well, honestly, most people tend to overreact, which actually may worsen the situation. People have a tendency to check their blood pressure too often, and this just creates a futile cycle of anxiety, which raises the blood pressure, and then they check again, and it raises the blood pressure even higher, and so on. So it's probably wise to just space out your blood pressure checks when one is relaxed and avoid the situation. But consistent blood pressures over 140/90, especially if you're under the age of 60 and or diabetic, or if your blood pressure is greater than 150/90 consistently, if you're over the age of 60, then maybe it's time to. So when do I need medicine for high blood pressure? Well, when in doubt, contact your physician. These guidelines tend to change over time. Your physician may be a family practice physician, an internal medicine physician, cardiologist, or, believe it or not, a nephrologist. It's very likely that if your blood pressure on average over 6 to 12 months, despite conservative measures, is over 140, they might consider medications. Or if you're older, like over age of 60, they may not consider medications until your systolic blood pressure is greater than 150. So what can you do to avoid taking medicines? Well, certainly the first step is to address lifestyle issues. If you're a smoker, you would definitely need to stop smoking. Reduce alcohol use. Lose weight. Regular exercise. Reduce stress in your life. Things like yoga, meditation. Lots of life stressors out there of multitasking. It's difficult, but it will help a lot to reduce one's blood pressure. Avoid chronic use of these medicines I mentioned earlier about benzodiazepines, opiates, stimulants. As far as diet goes, certainly no added salt, and a diet high in fruits and vegetables usually will go a long ways towards preventing hypertension. Certainly we can't forget about those supplements out there. Scrutinize the supplements, especially weight loss supplements. They can have some hidden stimulants in there. So what can you do to avoid taking medications? Well, you need to monitor your blood pressure first of all, and your heart rate tends to go up with stress. You may need some lab work done, including your kidney function, your blood counts, and your thyroid, possibly. And we need to monitor your weight. So, let's say you have high blood pressure. What now? Well, certainly you can consult your Cirrus Medical Network physician to get these labs ordered and look for underlying causes and risk factors. An EKG may be ordered to see if there's any electrical issues or old heart disease, or ischemic changes where there may be a blockage in the heart, blood flow to the heart. Make sure you keep a blood pressure log and show these results to your doctor. With Cirrus Medical Network, you can easily send in your blood pressure readings via the secure portal in secure messaging, or you can upload your blood pressure log to the portal as well. Make sure you inform your doctor if you have diabetes, high cholesterol, or a family history of heart disease. It's very easy to set up a virtual visit with Cirrus Medical Network and message your doctor directly, as mentioned. So what do I need to know about these blood pressure medications? Well, it's simple as the ABCDs, kind of. The ACE inhibitors, or ARBs, are generally considered one of the first-line medications in most scenarios. Other medicines include beta blockers, which tend to slow down the heart rate, may cause some fatigue, calcium channel blockers, and diuretics. As far as emerging or alternative treatments for blood pressure, there have been studies using L-arginine, vitamin C, and vitamin D, some of which have promising results, though the jury still may be out as far as mainstream use of these medications or supplements for treatment of high blood pressure. Cause harm and may help. What about monitoring your blood pressure while on medication? As stated before, you don't want to get overzealous with your blood pressure checks. Certainly in the beginning, when one is put on medicines, it's a good idea to check a little more frequently, and then with any sort of medication change. Once you've been stable, it's a good idea to check in with your physician every few months. And of course, if you notice any symptoms. If your blood pressure gets too low, you may feel lightheaded, dizzy, tired, or weak. And you will probably need periodic lab tests for kidney and or electrolyte levels. This can be determined by your physician. High blood pressure or hypertension can be diagnosed and managed by your CirrusMED physician online. Obtaining a thorough history, ordering appropriate diagnostic testing, and regular follow-ups can be achieved using telemedicine. Treatment options vary from lifestyle changes to medication.